Since the end of 2019, the coronavirus, which started in Wuhan, China, has spread to over 25 countries. And according to official figures on February 8th, the day that we're filming this video, there are now more than 30,000 confirmed cases and over 600 deaths. Here in Hong Kong, there are currently 26 cases with 1 death, and both the number of confirmed and suspected cases keep increasing. So today we are going to speak to 2 medical staffs to understand more about the situation, the difficulties that they're facing, and also what help they think is most needed at the moment. Because of privacy reasons, the interviews will be conducted over the phone and their voices will also be modulated. But before we get into it, I hope that you can watch this with an open mind, open heart. I know that all of us have our own opinions on different topics and situations, but the point of this video is not to spread more hate and negativity, but that we can all try to understand the situation from different points of view. Thank you so much for taking the time to speak to me and the audience today. Can you tell us about the main challenges you and the other medical staff face in your daily job with the current coronavirus situation in Hong Kong?
I think the most challenging part is the fear of the upcoming outbreak that we're foreseeing here, because we're still undergoing the peak flu season and the medical wards capacity has already reached around 110% in my hospital. The overcrowded ward environment is already putting a lot of stress on medical practitioners, and the infection control is very hard to keep. With the increasing number of the suspected cases of the coronavirus, we are also scared of the protective equipment that we are having now will be consuming too fast, and later on we won't have enough equipment to combat the outbreak. For some high-risk procedures, we do require using N95 and a full protective gear, but because of lacking equipment, we can only use one N95 mask for the whole ward for a couple of patients, but without changing for each patient, which is quite worrying if we can keep the infection standards as what the guideline has told us to do. Most of us are using the equipment very cautiously, and we've already noticed some sourcing orders. Mask or PPE are coming back really slowly.
嗰個問題就係床位分配上嘅資源問題啦。我哋喺病房裏邊都做唔到即係標準，即係最少1米嘅距離，其實已經係令到呢一個病毒好易喺呢一個病房裏邊傳播咯。
And what's your take on the current policies regarding the coronavirus situation, and how are they impacting your jobs?
It might seem like more border checkpoints have been closing, including Lowell and Lok Ma Chau, and a mandatory quarantine of 14 days for anyone arriving in Hong Kong from mainland China has been implemented recently. But around 60%, which is about 10,000 travelers from mainland entering Hong Kong via the international airport and Shenzhen Bay each day, which these 2 ports are still left open. Then, as Carrie Lam said, the number will be significantly reduced because of the new implemented strategy. Is Hong Kong really capable of containing these 10,000 people for a 14-day quarantine? Do we have enough isolation room? Do we have enough protective equipment, enough facilities to do that? I think this is what we are most worried about.
所以我哋一開始就已經好明確咁表明我哋封關嘅目的就係想減截呢個病毒嘅源頭，令到呢個社區感染或者社區爆發嘅機會會減少，或者將佢嘅情況減到最低。另外佢哋又訂唔到口罩，因為平時3個月嘅儲備係不嬲都係只係夠醫護人員正常咁使用，但係講緊而家係要派埋俾所有病人都要帶，咁嘅情況下，其實3個月嘅存貨其實好快就會用晒啦。咁其實對前線嘅醫護人員嘅裝備，佢哋嘅保護已經係好唔夠。
What do you think is most needed right now from the public? Us as citizens, what can we do to help with the situation?
None of the suspected and confirmed cases in Hong Kong had recently been to mainland, while some of them had also attempted to conceal the important information such as travel history. In normal wards, we only have surgical masks and gloves as protection, but it's not until the case is listed as a suspected case or confirmed case that we have a full PPE face face shield and N95. So if the patient does not reveal their travel history, we normally triage these groups as clean patients and will be admitted to the general ward. So if later on this patient becomes a confirmed case, the virus that was carried has already exposed to unprotected surrounding patients, ward staff, and the staff can carry to their families. So I sincerely really encourage anyone that has any symptoms, please be honest to your medical staff or your doctor or nurses or anyone, because we are here to help. The earlier you get your medication or the earlier you get treatment, the better chance of you recover, and it's better for us to better protect the others and protect the medical staff as well. It is also the most effective measure of preventing an outbreak.
And what measures do you think are the most urgently needed from the policymakers?
最重要都係要堵截其他仲有新嘅源頭可以入到嚟香港。我希望政府可以做嗰啲有效措施去隔離或者追蹤懷疑受感染嘅人士，去堵截社區傳染嘅鏈咯。當然最後希望政府可以喺呢段時間增撥更多嘅資源，去買更多嘅防護裝備，俾我哋醫護人員又好，或者普通口罩等其他市民都可以得到足夠保護，令到社區傳播嘅機會大大減少。
Last but not least, let's end this video on a positive note. Can you share with us any example of kindness that you have seen during your work?
咁我哋基本上每個護士喺佢自己崗位嗰度咧，都應該已經抽定咗所謂生死簽，咁就會準備去一啲受感染啊，或者隔離病房嗰度工作頂替裏邊一班可能喺嗰度已經做咗好耐啊，或者可能有啲不幸。有啲醫護人員受到感染，我哋都會上去頂替佢哋個位嘅。
When we assign who is going into the dirty room, we agreed on doing a draw. And coincidentally, most junior staff that have less than 1 year experience got drawn out. And of course, the senior staff were quite worried about the juniors because after all, they are inexperienced in handling these situations. They can't even ensure that they can properly gown up and gown down themselves for effective protection. So the junior staff wanted to take the role because of responsibility and professionalism, but you can tell from their facial expression that they were quite worried, quite scared. Then our department manager decided to volunteer herself so that the staff that has experience with SARS, including herself, got the first rounds and the senior staff got the second round. So even though some of them have young kids at home, they still volunteered themselves. At hard times like this, I'm really glad to have them beside me.
Thank you so much to you both for your sharing today, and I hope that you and everyone can stay safe and that we can get through this together.